Hello and welcome to MUSE Clinic, Sydney-based clinic here with expert Dr. Stephen Lowe. Doctor, we've talked about the way that aging creates a loss of volume in the face, but there's certain other things that happen to the face as well. So apart from volume, what are other concerns?
So we're definitely understanding better as time goes on these various changes that are happening. And so years ago we thought that it was really just all about volume loss. And I think when you saw those people in those early days with lots of filler, they just look overfilled because they've just been so reliant on filler as their only mechanism for improving their look. But I think we're understanding that there's a number of changes happening at a number of different levels under the skin, including changes to the bony structure of the face. But I think we also understand that there's a laxity that develops, there's a softening of some of the ligaments, there's a descent of some of the fat compartments, and that tends to give a little bit of a heaviness or laxity to the face, and I think that's where a big focus of our treatments should really be.
So when the gravity pulls the face, sagging downwards, it's a question of tightening and retracting to regain more of that youthful resistance and that springiness.
Yeah, I think so. And I mean, the filler can help achieve that. So carefully placed filler can achieve the illusion of lift. But really we have to be careful about not adding too much weight to weight. So if our face is already descending, we're starting to see that sagginess and that laxity. I think we do have to be very careful about not adding more physical weight in the form of filler to those aging, sagging faces.
And is tightening through non-surgical means, I guess, an updated, modern and less aggressive way to target aging the way we used to in days gone by, where we would think of tight faces as faces that had actually physically been pulled back? So how do we recreate and achieve that result in a softer, more modern way? What are the modalities that you like to use?
So we still have surgery. I think surgery still has a very useful place for people who want to see a bigger result. They are willing to compromise some downtime or some maybe a little bit more risk with a bigger result. But there's certainly lots of people who don't want to even consider surgery. It's just not on their radar. And for those people, I think we have options like radiofrequency, which heats up the tissue, stimulating production of new collagen, new elastin. And those treatments are more gradual and we'll see a progressive effect. And then we also have ultrasound-based machines, which is Ultherapy, to really recreate that, again, that lifting and that tightening over a series of months. But for lots of people, these more subtle progressive treatments are a great option and don't have the downtime or some of the risk associated with more aggressive invasive procedures.
So Ultherapy is interesting because you're exploring with ultrasound technology, which most people will be more familiar with in terms of being able to explore the body by sending sound waves and seeing imagery. So this is probably a new vanguard that a lot of people aren't aware of.
So therapy has that lovely approach because you've got the ability to image under the skin with the ultrasound technology as you've described. So be able to see those different layers and different compartments under the skin, but then also be able to utilize the ultrasound and focus it into very small pockets, which generates heat. And if the body's exposed to heat, it repairs itself by growing new collagen and elastin. So Ultherapy has that lovely ability to be able to see what we're doing and be able to deliver a treatment at the same time, making it safe and efficacious.
So you're triggering the wound healing, you're kickstarting the body's natural healing processes, but to healthy skin to make it more beautiful, more youthful.
I think that's the foundation for most of these tightening treatments, is to trigger the body into self-repair, to harness that amazing ability that the body has to be able to repair itself when it's injured, and take advantage of that to try and recreate lift and tightening in the face where we want to see it for an anti-aging benefit.
And because Ultherapy is relatively gentle, you would recommend it for someone perhaps that's starting out that's not ready for more aggressive or interventionist lasers or anything with a lot of downtime. So Ultherapy is fairly gentle?
Ultherapy doesn't have much downtime, which is a huge advantage. I mean, it's a little bit uncomfortable at the time of the procedure because there's some heat involved, but there's certainly things we can do to reduce some of that discomfort and make it a more pleasant experience. But the results are worth it, and the results for somebody who is willing to have a little bit of downtime just in terms of an afternoon off work or maybe a little bit of tenderness for the day or so afterwards, the results that then are achieved over the following weeks and months I think are well worth it.
And it's interesting how often because the face, of course, the eyes are the windows to the soul, is such a main focus for people coming in, and that's where their fears tend to focus, and they might neglect their hands or their neck and neck and décolletage. Ultherapy, I believe you also apply to those areas. What would you say about people that haven't even thought about neck and deck, as we call it?
I know. I think the neck and deck has to be considered almost from the very beginning of our treatment plans. I mean, understandably, most people come in with primary concern is about their face. That's really what they're looking at in the mirror, what we look at in each other. But if we invest lots of time and effort to try and improve the face, and we neglect the neck and the décolletage, then they just get further away from each other. And then it's more telling you've had something done to your face, because the neck and the décolletage are still aging and 10 years old.
Oh, so it's a bit like the portrait of Dorian Gray. We've got the good versus evil.
And then it's much more of a telltale sign you've had something done to your face.
Yeah.
So I think, whilst it may not be everyone's priority when they come in, I think it's up to us as the doctors or the nurse or the injector or the therapist to make sure that we include the neck and the décolletage and the hands in our treatment plan, so they're not neglected, and we're not having to then address them 10 years later and try and catch up time.
And circling back to tightening, so what areas would you say are the must-dos for tightening?
So for me, I think that we have to focus on the back of the face, because I think the problem or the concern I have about dermal filler when there's too much of it at the front is that as we all age, everything drops forward anyway. And if we then add more volume and more heaviness to those areas, we just recreate and enhance this heaviness. So for me, it's getting the lift from the back of the face. And I think we can achieve that with our radiofrequency or therapy devices, where we're really targeting that lift so that we get more of a pullback effect and we don't add more weight to weight.
That's fantastic. And what age would you say, in terms of working on the back of the face, just to kind of create that support, and also with the neck and deck or décolletage, when should people start thinking about that? Before they're seeing anything? I Magic
think
question. How long is a piece of string?
I mean, I think there's scope to start considering those areas in people's late 30s, certainly into their 40s, certainly into their 50s. Because by the time you see people for first presentation when they're maybe in their 50s or 60s or beyond, and they've had no treatments to those areas, we can certainly do things to try and see improvement, but we're never going to really achieve major results without being able to incorporate surgery or consider surgery as an option as well. So I definitely see a role for people doing some of these treatments in their 30s, 40s, 50s, and just chipping away at the problem rather than leaving it and neglecting it until it really needs something much more drastic to achieve some improvement.
And I believe too that often people start to panic a little bit about their décolletage and neck way later than with face, because it was less of a focus, it was perhaps a bit more neglected. So obviously the key is, don't wait till prevention is better than cure. Don't wait till it's gone way past the point where intervention is going to really work.
And I think we even see that with skincare. I mean, we tend to focus all of the skincare products on our face, but you know, there's absolutely no reason why we shouldn't be applying our face serums and
all the way down. It's a great habit.
Down onto
why
your
not?
neck, down onto your décolletage, onto the back of your hand. If there's any product left in the back of your hand after you've been doing on your face, make sure you're rubbing it to your hands, because there's no reason why these areas should be neglected. But you know, the sun, particularly in such a harsh climate, the sun is going to damage the décolletage and the neck just as much as the face for women who have worn t-shirts or low-cut tops over the years. And so we should be absolutely focusing on those areas too.
And again, defence as well with SPF if you're wearing, as is most likely in Australia, a low-cut dress. Yes.
Yeah, I mean, number one skin anti-aging product will be our sunscreen. And whilst we can achieve lots of improvements to the skin with things like retinols, vitamin A's, and various fruit acids and various B vitamins, the primary thing is defending the skin against the damaging effect of the sun.
So I suppose if somebody doesn't want the droop and they don't want the surgery, there are definitely ways to target the skin by actually tightening it and creating that support to create redress the balance and return to a more youthful looking state.
Definitely.
Fantastic.
Thank
you.